Yes.
I just want to plant a seed of thought for an ultimate option if we're not able to stop this through present litigation and political means. And that is to consider the option of condemning Sutter Coast and having the county essentially take it in a condemnation proceeding and then begin to solicit a buyer for it and flip it to a private sector owner, because that would stop this.
I leave it to the expertise of the attorney in the room, but I can tell you support like that is very much appreciated. Kevin and I have worked, I think, about as hard as we can, and we need our representatives to step forward and help us. And I know many of you have worked really hard too. I mean, we have well over 2,000 signatures on the petition, and most of those are just people that came to my office and signed them. We've seen the letters to the newspaper, and it's also clear that if our elected representatives don't do anything, Sutter will do this. There's no question in the boardroom. So we gotta go to the next level, yes?
Currently, does Sutter send their profits to a corporate headquarters as a nonprofit? And in the critical care situation, if we were to go to that, would they continue to make a profit? Is that projected?
Those are two excellent questions. The first question is yes. So every 2 weeks, there's what is called an equity cash transfer policy, and we're only allowed to have 2 weeks of operating capital. We can only make one payroll at this hospital. Any extra cash goes to Sutter, to a place called the Sutter Treasury. When it goes to the Sutter Treasury, it becomes the property of Sutter Health. So we know for sure, based on public documents, that for 26 consecutive years, we sent an excess of money to Sutter over what they sent us. In 1999, we were the most profitable hospital in the entire Sutter system, which includes 350-bed hospitals in the Bay Area. So we've been good to Sutter. Last year, it's now a matter of dispute. I just saw the publicly released IRS tax forms, and they show a $7.3 million transfer from Sutter Coast to the Sutter Treasury, and a $2.3 million, I believe, operating loss. So if you do the math there, it looks to me like we were still in the black, but they're going to dispute that, and I can't sort it out, and I'll tell you why I can't. Because they won't let me see the books, even though it's the unrestricted right of every board member to inspect any document, to bring an attorney, to bring an accountant. I've been denied that countless times. The latest version, and I must have asked them 15 times, is I can see them, but I can't share it with anybody. Well, that doesn't do me any good. I need to share it with people that know the answers. So the finances of the hospital are really murky. 26 years, no question about it, profitability. Now, Martha McClure mentioned a request for records from the hospital last Tuesday, and I really hope they follow through with that, because the healthcare district, of course, is in litigation, and they issued a subpoena for those records, and Sutter ignored the subpoena. So it makes it hard to understand, under those circumstances, what's really happening financially. Did you have was there a second question there?
And under critical access, is it projected that they'd continue to make a profit?
Yeah, so the benefit to critical access is for all their Medicare patients, they're guaranteed reimbursement slightly more than it cost them to provide the care. It's called cost-based reimbursement. So you get a little bit of a margin on your Medicare patients, and you can still charge your privately insured patients. And I did a little price comparison with some Bay Area hospitals when I was down there last fall, and it looks to me, I couldn't find any hospital that was more expensive than Sutter Coast. A knee arthroscopy, I'm going to say this knowing that some of you might need knee arthroscopies, are going to go to Medford, and I'm not going to be able to do the procedure. But a knee arthroscopy is $18,500 at Sutter Coast Hospital. That's the hospital bill. Operating time, when you're in the OR, no meds or anything else, is around $160 a minute. So, you know, it adds up when somebody can't find something. Go ahead.
Have a seat. Is this working? Yes. Dr. Duncan, I want to say thank you on behalf of everything you're doing. I am Roger Gitlin. I am the supervisor in District 1. And I can tell you that on the Board of Supervisors, there is no dissension on this matter. We are 5-0 in favor of doing anything and everything we can to retain top quality medical assistance and top quality hospital here in our community. This is really a David versus Goliath kind of matchup right here. We are up against a very formidable adversary in the Sutter Health folks out of San Francisco. They don't play nice, and they're in it to win it. And everyone in this room, we all need to get involved, and we need to send those letters out to the people that are on this list here and let them know about our righteous indignation. I'm so glad Bob Black was here to render his opinion as an attorney of what our options are, and we will be pursuing every available option. It isn't Democrat, it isn't Republican. This is an issue of the future of our community. And if we do nothing, if we sit back at the end of this day, you all go home and say, gee, what do we do tonight? We went to this meeting about health care and found out what Sutter's doing and then where we're going tomorrow night. You do nothing, then shame on us here in this room. So it's incumbent upon everybody here to write that. If you've never written a letter, make this your first letter. And I intend to write to the 3 people on here from my position as supervisor of Delaware County. This is not an acceptable situation, so I applaud you for continuing to do what you do at great risk to you, Dr. Duncan. I know this is not easy. Dr. Caldwell, you're in the same hot seat. This is not easy for you to do this. Your professional careers are on the line, and I personally am so appreciative of the fact that you're conducting this fight, so thank you very much.
Thank you. And I just want to say one thing about letters. This is a complex topic, and if you have questions about it, send me an email. I answer every email that I get over this, and if you're still not sure, send me another one. In terms of what do you say in a letter, my favorite quote the whole time was from John Alexander. I don't want to draw too much attention to John, he's back in the back there, but he said, you guys are hiding the ball. You remember when you were growing up and someone was hiding the ball? It isn't right, you know, besides being annoying. But unlike a game of street football, this is people's lives. This is no place to be hiding the ball. I don't think John would mind if you put that quote in the letter. Yes, go ahead.
It's me again. When you have a situation where something is illegal and there isn't an arm of enforcement out there to watch it or witness it or enforce the law, isn't the remedy the system itself? If you have a wrongful termination or a wrongful death, can't you have a wrongful execution of a contract because it is not? If they're going to call the letter of the law, then you have to call them accountable to the letter of the law. And I also have a question about when we speak about letters. While I realize we are a republic, we are a democratic republic, the idea of writing letters is great. I know that there are things like petitions, and I also wonder if there's a form letter option. If you're going to be able to bring any kind of a lawsuit, isn't it possible for a group like this to bring a class action lawsuit about the irregularities of their actions?
Is Bob still in the room? When it gets to class action, I have to defer to one of the 2 attorneys here.